Yeah, this guy. We'll leave him over here. Behind you guys, whoever was at that bench, bring me that trachea, that one, that larynx, and that trachea too, behind you there. Yeah, Adam, that one there. There we go. Okay, so here are the bulk of the models, you guys. Let me get something to use to poke with and show.
What?
Okay, so I'm gonna look over your just list as we go along. Okay, so nasal cavity. You see things really good. Again, if you have camera, just don't block people's views that don't have cameras or whatever. Okay. I feel like I'm in Hollywood. Okay, so where you stick your finger in your nose here is the
Nostril.
external nares. External nares. So I would ask when my Q-tip's going through, you say external nares, and you can see it here also, right here, external nares. The area right inside is like the entrance of the church, and that's called a vestibule. So this is a vestibule here. This area right here where you can stick your finger once you stick it inside your nose. Okay, the vestibule. The nasal septum you see here is this portion right here. So this is the cartilaginous portion, the bony portion. Okay, and it keeps you from, again, putting your finger from one side of the nose into the other. And that's what gets holes in it from cocaine. Okay. Superior, middle, inferior nasal conchae, superior, middle, inferior nasal, inferior meatus. That's what these things are right here. Here's a superior conchae, middle, inferior, superior, middle, inferior, superior, middle, inferior. The holes underneath here, those are the meatuses. So this would be the inferior meatus, middle meatus, and the superior would be in there. Okay. Internal nares. That's this portion right here. Is not well defined, but it's before that hole. And so that's in the back of the nasal cavity. And what it separates the nasal cavity from the nasal pharynx. Here too. It'd be like right about here. This would be the internal nares. Separates the nasal cavity from the nasal pharynx. Okay? If you look next on the bullet points under pharynx, notice 3 bullet points: nasal pharynx, oral pharynx, and laryngopharynx. Okay, so on this model here, this area here is the nasal pharynx, this is the oral pharynx, this is the laryngopharynx. Okay. Now, in the nasal pharynx, the things that you need to know was this opening right here and here to the auditory tube. That's what that is. Okay, opening to the auditory tube. This is the pharyngeal tonsil here and here. Pharyngeal tonsil. We looked at that the other day. And then you have the hard palate, soft palate, and the thing hanging down the back of your throat is that uvula. Okay, you know, when you open your mouth and you look at the uvula. Okay. Oral pharynx. There's a picture in your book, but it's in digestion with the mouth wide open and you're looking back in it. And you can see these structures really good on that picture. So, and I'll show you that picture when we do digestion. So you want to look at that picture probably sooner than later. And so in the back of the throat, mouth, back of the oral cavity, you're going to have this tonsil right here, and that's the, which tonsil?
Palatine.
Palatine tonsil. Now notice there's these 2 little folds, and it kind of sits between them. And if you open your mouth, you can see those, okay? And so remember, this is the pharynx, okay? And so one of the folds is and this is the palatine tonsil, and this is the tongue. And so start with palatal for both of these. This is the first word. The one closest to the tongue would be the palatine glossal fold. Palatal glossal fold. Right there, see it? Palatal glossal fold. The one close to the pharynx would be what then? Palatopharyngeal fold. Okay?
It says arch in the lab manual.
Yeah, arch, you're right. They're arches. Sorry. So right here is that palatine tonsil. Okay? And so what would this be right here then? Palatoglossal arch. This one here would be the palatopharyngeal arch. You see those arches now? You okay with those? Okay. Lingual tonsil, remember that's at the base of the tongue here. That area right there. Okay. Laryngopharynx, that's this area here. Okay. And next you'll see the larynx, and that's what this all is here, is your voice box and larynx. So this is a larynx model here. Here's another one here. The tongue actually comes off of this one, okay? And so that's this portion right here is your larynx, okay? And this is a larynx model here. I think first as we're looking at the cartilages, I'm kind of looking this upside down, so keep me honest. Let me show them to you here. All the soft tissue is off, okay? And so this is your thyroid cartilage. You can feel that yourself right here, your Adam's apple. That's what that is. You slide, you grab it on both sides and move it, okay? Thyroid cartilage, notice it's big in the front and it's absent in the back, in the posterior side, okay? Right below it, you actually can feel that there's a little notch, and then you get to the cricoid cartilage right here, small in the front, big in the back. So this is cricoid cartilage also, okay? Then this is your epiglottis right here. That's not your tongue. What's this here? Thyroid bone, exactly. And then you can see these little triangles here. And somehow this one got pulled off. There we go. There we go. So these actually open up your vocal cords here. And so the big triangle here is your arytenoid cartilage. Okay? And see the little triangle on the tip of it here? That's your corniculate cartilage. So arytenoid, the little triangle on top, corniculate. Now there's soft tissue that runs between that corniculate and the epiglottis. It's just not seen here. And in that soft tissue about this area here is going to be where your cuneiform cartilage is. And I'll show you on this other model where it's at. So, what cartilage? Thyroid. See how it's absent back here, but that's part of it here. Cricoid, bigger in the back. That number 4 area is arytenoid. The very tip of that is corniculate cartilage. Now, see this folded tissue going from the corniculate cartilage up to, this is the epiglottis right here. This thing that looks like a tongue, but it's not the tongue. This little fold right there, that little bump right there, is your cuneiform cartilage is in there. Right in there. Okay, that's where your cuneiform is. And again, this is the epiglottis. Now, there's a hole between your vocal cords in there that air passes through. And the Q-tip is going through it right there. That's like your pupil. Remember, your pupil wasn't something you could touch. It was a hole through the iris. This is your glottis. Okay, your glottis. Actually, that's the view you see when you're trying to intubate somebody. Okay, and that's what you actually, with a laryngoscope, have to see those vocal folds. So if you pop this open, this fold right here is the vestibular fold or false vocal cords. This one right here is the true. False, true. Vestibular fold, true vocal cords. I like to say you got to dig a little deeper to get to the truth. Okay? So it's the one that's further away or you know, more distal from your epiglottis. Okay? When you look at this, you can see this is epiglottis right here. This thing here. Here's your thyroid cartilage, cricoid. You can see this stuff on the half head, you guys. Okay. What's this? Epiglottis. What's this? Thyroid. This back here? Cricoid. And what's this fold right here?
False.
False. This one right here? True. So you can see these same things on this one. Okay. So. Extending down below that cricocartilage, this is the trachea. And those are all the tracheal rings. Notice that they're absent on the posterior surface because that's where your esophagus sits. Right there. Okay. So, same thing here. These are the first few rings of the trachea. Okay. You have all the same structures here. What's this? Thyroid gland. Good. Yeah, sorry, sort of threw one in there on you. This here is your trachea. Where it divides right here is your carina. Okay. It now divides it. Did I get everything on that? Yeah. Okay. Tell me if I skip something. Okay. So it divides, and it's going to go in the right and left lungs. As soon as it divides, this now is the primary bronchus. This would be the right primary bronchus. This would be the left. The other name you'll hear called is main stem bronchuses. The primary bronchuses now divide into secondary bronchuses. Okay, and there's a secondary bronchus that goes at each lobe. On the right side, you have 3 lobes: a superior, middle, inferior. On the left side, you just have 2 lobes: a superior, inferior. And so this would be a secondary bronchus, actually to the superior lobe on the right. This would be the secondary bronchus to the middle lobe, and this would be the secondary bronchus to the inferior lobe. Here is secondary bronchus to the superior lobe. This would be the secondary bronchus to the inferior lobe on the left. Now after that, they're called tertiaries. And so these all out here are tertiaries. This is here. These are here. And each division is a tertiary. You'll have like 18 to 20 divisions, like on the branches on a tree. So these even divide out more. A bronchus is going to have cartilage on it. Okay? And all the way out. And that determines what a bronchus is. We okay with that? So this is a good model for showing you that. Let's see, where are we at here? Terminal bronchioles you don't see on these, but I'm going to show you over here. So you just flip that over. And what we're after now is this model here. This would be a microscopic view of a portion way out in the lungs. Okay? And so this is a terminal bronchus coming in here. It still has cartilage, the blue on it. Okay? So that's your terminal bronchus. This would be the outer covering of the lung, and that's pleura. It's on the lung itself, so it's visceral pleura. Okay? And so, what is this blood vessel right here?
Pulmonary vein.
Pulmonary what?
Vein.
Pulmonary vein. What's this one here? Pulmonary artery. Okay. So, when you lose the cartilage out here to these things here, these are now bronchioles. Okay? Bronchioles. And as soon as you get to a point where there's actually some air going past it, where you can have some air exchange, this would be a bronchiole right here. This would be a respiratory bronchiole right here. Now, you're going to go out and you're going to divide into little air sacs, okay? Individually, they're called alveolus. Multiple ones are alveoli. So each of these little, like, grape sacs are an alveolus. Multiple are alveoli. Here you can see the insides of them. So if I point there and ask you what that is, you'll say that's an alveolus, or multiple ones would be alveoli. The alveoli connect with each other through alveolar ducts, and that's what this inner black thing is here. That would be an alveolar duct. Now, a whole group of them together form an alveolar sac. So here's an alveolar sac, here's another one here. Okay. And so those alveoli are going to be covered by capillaries. That's what this red mesh represents, is the capillaries that are on it. And then the black stuff here that is elastic tissue on top of that. That's what that represents. Did I get all those there?
Which was the elastic tissue?
I'm not going to ask you that.
Okay.
It's not on your list. I was just throwing it at you. So the rest of that, the gross surface anatomy of the lungs, you can see on these models on the side here. Okay.
The what?
Hold on.
This is not going to work.
So this is the left lung out of this guy here, okay? And so this would be the apex of the lung up here. This would be the base of the lung on top of the diaphragm, okay? The hilus or hilum, singular, is the area where the blood vessels come and go. So this is the hilum right here. So this area right here would be the hilum of the lung, where the vessels are coming in and out of it, okay? This is the left lobe, and so left lung, and so you have two lobes, a superior and inferior, and it's divided by this oblique fissure on the left side, oblique fissure. The right side has three lobes, superior, middle, inferior. This would be the horizontal fissure, separating superior and middle, and this is the oblique fissure. Okay. And again, the other thing I forgot to tell you here on this left side, this is where the heart kind of pushes in. So this is the cardiac notch. Okay, cardiac notch. This is the mannequin's right lung. So you can kind of see what the whole lung looks like here. Okay, apex, base, hilum, where the blood vessels are coming and going. You should be able to, in the hilum, tell me, what is this red? Pulmonary vein, the blue. And what's this right here then? Right primary bronchus. Okay, so that's the primary bronchus going to the lung. And you can see it kind of dividing into secondary bronchuses. Okay. Here you can see the different lobes. Superior, middle, inferior, horizontal fissure, oblique fissure. Okay. Left lung on this one, cardiac notch, oblique fissure, superior lobe, inferior lobe. Did I cover everything on there? You guys go till 50, so you've got a good 25 minutes to work on this while I'm here. Okay. Remember,